Hello, my name is Dr. Sharon Balter, and I work for the Los Angeles County Department of Health. I'm happy to be here with you to talk about hepatitis A. Today, we'll talk about what you can do to protect yourself and others. By the end of this presentation, we will be able to describe hepatitis A, learn how hepatitis A is spread, identify who is at risk for getting hepatitis A, and describe what we can do to prevent hepatitis A. So first, I'm going to start by defining what hepatitis A is. Hepatitis A is a highly contagious liver disease. There are different kinds of hepatitis, but what we will talk about today is hepatitis A. It's caused by the hepatitis virus, which is a germ. Some people have mild cases that can last a few weeks, while others experience severe cases that can last several months and in rare cases be fatal. How does hepatitis A spread? It spreads by putting something in your mouth, an object, food, or drink that's been contaminated with feces or poop of an infected person. It can also be spread by forgetting to wash your hands after using the bathroom or changing diapers, having sexual contact with an infected partner, consuming food or drinks contaminated by the virus, or sharing equipment related to recreational drug use. This is not limited to injection drug use. Sharing of any equipment related to recreational drug use can spread the infection. Persons with hepatitis A can spread the infection for a week before they realize they are sick. And some people may never have symptoms even when they are infected and can still spread the infection. This is one of the reasons hepatitis A is so contagious. Generally, people can only spread the infection for a couple of weeks, but some people will be able to spread it longer or even for months. After you fully recover from hepatitis A, you can never get it again. What are the symptoms of hepatitis A? As I mentioned, some people can have the infection but not have any symptoms. But most adults, about 70%, will have symptoms, and they usually appear between 2 and 6 weeks after the person is exposed to the infection. We will talk more about the symptoms on the next slide. Symptoms include fever, feeling tired, loss of appetite, nausea, vomiting, stomach pain, dark-colored urine or pee. This would be the color of Coca-Cola, very gray stool or poop, joint pain, and a yellowing of the skin and eyes, which is also called jaundice. How is hepatitis A treated? There is no specific treatment for hepatitis A. So when someone has hepatitis A, treatment includes rest, good nutrition, fluids, and medical monitoring. Some people need to be hospitalized. Anyone who has symptoms of hepatitis A should see a doctor. Death is rare, but is more likely in those who have problems with their liver to begin with, such as chronic hepatitis C, chronic hepatitis B, or alcohol-related liver disease. You may have heard about the hepatitis A outbreak in San Diego and more recently in Santa Cruz. Over the next few slides, we'll share some information and talk about hepatitis A rates in Los Angeles County. The first case of hepatitis A in San Diego appeared on November 24th, 2016. Spread has been very rapid among the homeless population because of poor sanitary conditions. As of September 13th, 2017, San Diego was reporting 421 cases of hepatitis A, with 292 hospitalizations, that's a 70% hospitalization rate, and 13 deaths, or 3.8% of the cases. 80% of the outbreak patients are homeless or use illicit drugs. This is an unusually high death rate, and it most likely reflects prior illness in the affected population. By way of comparison, in general, in the United States, we have only 100 deaths in the entire country every year from hepatitis A. So to have this number in a single city is very high. In Los Angeles County, we have 35 to 60 cases of hepatitis A every year. Hepatitis A rates are generally highest in people who are 35 to 44 years old. Oh, I'm sorry. I apologize. In the San Diego outbreak, small groups of cases have taken place in people who serve the homeless population. So although most of the case patients are themselves homeless, some people who work with the homeless have also become ill. In addition, there have been cases in jails, residential drug treatment facilities, single-room occupancy hotels, and assisted living facilities. There have also been, as I mentioned, a small number of cases among volunteers, sanitation workers, healthcare workers, and a parole officer. In Los Angeles County, there are 35 to 60 cases every year. The highest hepatitis A rates are in people who are 35 to 44 years old. In recent years, we have had no cases among our homeless population. So now we're going to talk about who is at higher risk of getting hepatitis A. So in general, when we are not having an outbreak, anyone can get hepatitis A. Right now, people who are homeless in San Diego are at the highest risk. In regular times, we say that people are at high risk if they travel or live in countries with a high rate of hepatitis A, if they live with someone who has hepatitis A, if they use any recreational drugs, as I mentioned, not just intravenous drugs, if they are a man who has sex with other men, if they have sexual contact with a partner who has hepatitis A, and if they are homeless. But as I mentioned, in San Diego right now, the overwhelming majority of cases are homeless or using recreational drugs. Who is at risk for severe illness? People who are over 50 years of age, people who have an underlying problem with their immune system. We say their immunity is compromised either by an illness, such as HIV, or by a medication, such as chemotherapy. People who have hepatitis B or C or other liver disease. In these people, the illness may last longer and in rare cases may be fatal. Who should get vaccinated? Since 1999, the vaccine has been available to all children at 1 year of age and older in Los Angeles County. Any adult who travels to a country where hepatitis A is common should be vaccinated. Family and caregivers of adoptees from countries where hepatitis A is common should be vaccinated. Men who have sex with men, recreational drug users, people with chronic liver disease or hepatitis B or C, or people who are homeless. In addition, people who work closely with the homeless population are recommended to be vaccinated currently. How to prevent hepatitis A? The good news about hepatitis A is that it can be easily prevented. The best way to prevent hepatitis A is by getting vaccinated or getting a shot against hepatitis A, and we will talk more about that later. In addition to vaccination, hand washing with soap and warm water, vigorous scrubbing for 20 seconds before eating or preparing food, after changing diapers, or after using the bathroom. Some people have asked about hand sanitizer. In general, hand sanitizer is not quite as good as vigorous scrubbing with warm soapy water for 20 seconds. However, we understand that soap and water is not always available and that not everybody aggressively washes their hands even when it is. If using hand sanitizer, it's important to use a hand sanitizer that is 60% alcohol. Not all hand sanitizers are alcohol-based. If it is not alcohol-based, it will not work. Because, again, as I mentioned, hand washing facilities are not always available, we do recommend using hand sanitizer in that setting. However, prior to preparing food, it is always important to scrub your hands vigorously for 20 seconds with warm, soapy water, because the distribution of contaminated food has the potential to spread hepatitis A very widely. Other things you can do to prevent hepatitis A are: do not share food, drink, or smokes with other people. Use your own eating utensils. Do not share hygiene items like towels, toothbrushes, razors, or other items. And do not have sex with someone who has hepatitis A. What is the hepatitis A vaccine? As I mentioned, this is the most effective way to prevent hepatitis A. It is a safe and effective vaccine. Ideally, one would get 2 shots 6 months apart. Getting the vaccine is the best way to prevent hepatitis A. While 2 doses offers full protection, a single dose offers excellent protection, especially in adults. If someone has contact with hepatitis A virus, there will be a period of time between 2 and 6 weeks before he or she gets sick. And if you receive a single dose of vaccine within 2 weeks after contact with the hepatitis A virus, illness can be prevented. So even a single dose of hepatitis A vaccine in a healthy adult will prevent infection. So where can people at risk get vaccinated? Your personal doctor or healthcare provider. If he or she does not have the vaccine, it will be available at a local pharmacy. You can receive it at the pharmacy with or without a prescription from your physician, or your physician can obtain it from the pharmacy. You can also go to any LA County clinic, at the Department of Health Services, at the Department of Public Health, and the websites to locate these clinics are on the screen. DPH nurses, Department of Public Health nurses, are also working with outreach teams in shelters to offer vaccination. Finally, you can dial 211 to find the clinic nearest to you. What is the Department of Public Health doing to prevent an outbreak in Los Angeles? We are very concerned about spread of the outbreak from San Diego or Santa Cruz to Los Angeles. We are investigating all hepatitis A cases and recommending preventive treatment for all close contacts. However, we are also working to provide hepatitis A vaccination for all homeless people, regardless of recent contact, and conducting health education and promoting vaccination and improved hygiene or cleanliness. If you want more information about hepatitis A, you can obtain it through the LA County Department of Health, Public Health website, or the website at the Centers for Disease Control and Prevention. We've also included phone numbers that you can call. If you have questions that we are not able to answer today, though, I think we have plenty of time to take questions. And these are more places that you can get information. Again, you can call 211, visit our website, send us an email, or follow us on social media. So in summary, today we discussed, we described hepatitis A, learned how hepatitis A is spread, identified who is at risk for getting hepatitis A, and described what we can do